Okay, guys, so we're going to go ahead and pick up where we left off, and we're going to talk about cell-mediated immunity here. Okay, so this is really going to not be a situation where antibodies are really kind of ineffective against the specific antigen or microbe or whatever the situation may be, pathogen. So the idea here is that it's going to be a really complex system of different interactions. And the idea here is we still have the antigen presenting cell, but instead of having our B cell or T helper cell, which if you watch the other video that's going to associate this, I'm going to explain all of that together, just to kind of give you the whole stuff that you can write down in addition on one specific thing, which we're going to use my projector for. Okay. You'll see that the T helper cell and the B cell, those situations, there's not really, a whole lot that can go differently there. And again, we are just making it so that way that we can make more B cells and make more antibodies, and then the antibodies attack the pathogen and get rid of it. In this situation, a lot of times we're going to be dealing with T cytotoxic cells or cytotoxic T cells and natural killer cells. In both of those situations, what's going to be involved is we're going to look at the idea that we're going to secrete essentially what we call cellular secretions, but we're going to secrete specific toxins within our bodies to go ahead and fight against these specific cells and essentially induce the idea of apoptosis or programmed cell death and force those cells to become dead. Okay? So natural killer cells, they're a little bit of a small population of lymphocytes. And the idea is they look similar to our T and B cells, but they're not quite the same. A lot of times these natural killer cells are really useful in preventing us from getting tumors. So the big thing that they're talking about here with a lot of times with T killer cells or natural killer cells, we are looking at more tumors. And how do we prevent those? Well, we use our natural killer cells because they can more target the idea here. They don't have any antigen specific recognition. So therefore, they can tell that these cells that are going to become tumor cells recognize and need to be put into cell death, and that's essentially what they'll do. So in addition to this idea, we also get a situation with cell-mediated response where we can oftentimes have what we call hypersensitivity. And the idea behind that is that we have an oversensitive immune system. The purpose behind this is going to be to essentially what happens is we have more of like your anaphylactic shock reactions. Usually it's going to be whenever you have a specific antigen that comes into your system, you're going to feel some type of allergic response is the idea here. Hypersensitivity is essentially an allergic response. So you have types 1, 2, and 3. Those are an immediate types, and they'll happen within 24 hours of contact. Delayed type, usually that can take more than 24 hours to manifest themselves, and they're typically type 4 sensitivity, hypersensitivity reactions. So your type 1, those include your typical allergic response symptoms. They're going to be your asthma, hives, gastrointestinal symptoms whenever you have, food allergies. So your celiac disease, and you're, allergic to gluten, essentially the gluten allergy, the swelling and, issues that you have within your within your intestines will occur within 24 hours, or at least start to occur within 24 hours. A lot of times you have stings or allergic responses to drugs if you get, hives from a drug, or if you have an allergic reaction to a drug, you go into anaphylactic shock from taking a specific drug or a specific sting. Okay. Type 1s are probably the most common. And the idea here is that they're typically considered allergic responses whenever we talk about a type 1 immediate hypersensitivity response. What happens is that they produce IgG reactions, okay? So our IgE antibodies. What happens here is that those ones are considered those are considered, I guess the best way to put this is, those are considered our allergic response antibodies. And they're attached to basophils, which is another type of leukocyte or white blood cell that you would find in your body. They're a little bit smaller, and typically you can tell if you're having an allergic response or if you are more likely to have an allergic response by then counting the number of basophils within your blood. If your basophil count's a little higher, then clearly you're having some type of an allergic response. Okay, and this is what we call. Basically, what happens is that once the IgE binds to the basophils, we're going to get what we call mast cells. Okay, and those will basically produce the response for the allergen. Okay, so this is how it works. You see, you've got your allergen, you got your plasma cell, and your IgE antibodies. Happens is that your IgE antibodies attach to your basophils to form your mast cell. Your allergen then binds as if it's an antigen to your IgE cells, and then you start to have your allergic response. And basically, how they do that is they, your mast cell will start going ahead and getting rid of leukotrienes and histamines and prostaglandins, and those basically are chemical mediators that a lot of times can indicate inflammation or sneezing or all those other allergic responses that you're well known for. Okay, so this is just basically pictures of what happens with a basophil. This is basically showing that on a rat. Okay. So a lot of times here with whenever we talk about this, we have a lot of times it's mostly going to be localized reactions. So if you get like a food allergy or something like that, you're going to have those localized reactions within your intestines. Or if you have, asthma, that's only going to be in your respiratory system. However, you can also have ones that cause for stuff throughout your body. For instance, a peanut allergy would be a good example. They can happen throughout your body and cause anaphylactic shock, which is very much life-threatening. That's why we have that. So these are just some examples. So here, this is systematic anaphylaxis. Essentially what happens is that we have chemical mediators in the bloodstream, and therefore they go throughout the body. They're much more worse than localized anaphylaxis because you can also have anaphylaxis within one specific area. They're kind of ones that are mostly going to be involved in this, obviously like bee stings and drug allergies. A lot of times peanut allergies are a good example too of going into anaphylactic shock. You can do that. If you have a latex allergy, a lot of times this can create just kind of more of an irritant, so like a rash, or you can get a type of hypersensitivity out of it as well. So like, the people that can't be touched by latex at all, they would probably be the immediate type hypersensitivity situation. You can get tested on this. Essentially what they do is they put a little bit of the allergen underneath your skin, and they see what happens, whether or not there's, some type of a reaction, whether or not there's like, basically what they call is a cutaneous anaphylaxis. Essentially what that is just, does it get red or does it not? Or does it go away? And they just put a little bit underneath your skin to see what you're allergic to and what you're not. Sometimes if you have a specific allergen that you're severely allergic to, you can use immunotherapy or what we call allergy shots. Basically little doses of the allergen to essentially build up your, your tolerance towards that specific allergen. And the idea here is that we have these what we call IgG blocking antibodies, which essentially prevent the IgEs from binding, which remember, look how closely we had those IgEs and IgGs. They're very similar, okay? Very similar, just a little bit different here, a little bit different here, and a couple of different places for our disulfide bonds. So therefore, we can easily put them into the same place and essentially block the IgEs from being produced, and therefore you'll have more of a tolerance towards that specific allergen. You'll still be allergic to that specific allergen, but it will be a higher tolerance for you. Okay. Okay. So this here happens here. Whenever you have a type 2 hypersensitivity reaction, these are going to involve your cytotoxic T cells. And essentially what happens here is your cells are destroyed during these reactions. So essentially we're looking for initiated cell death. Okay. So this can a couple of different ways that this can happen, sequence of events that this can happen. You're going to have a particular drug that binds to the surface of the cells. You're going to have anti-drug antibodies that then bind to the drug. You're going to have this, what we call a complement system, which we're not going to go too far into for this class because we don't really have the time to. I can talk a little bit about it, but it's not super important. But essentially, it's just a way in which we initiate essentially cell death and lysis of the cell. Okay. So type 3 hypersensitivity reactions. So these are going to be involved in what we call autoimmune diseases, and they have, more or less immune complex reactions. They're going to involve your IgG and IgM antibodies, and you have some neutrophils as well. Remember, neutrophils are big into your phagocytes. And essentially what happens is you can kind of get them if you're inadequately treated. Like, for instance, if you get rheumatic fever or something like that, a lot of times if you have inadequately treated strep throat, you can get rheumatic fever and things that go on further. Rheumatoid arthritis is another example. Again, what happens here is that the immune complex that we make in our humoral immune system, humoral immunity, and also we do make this immune complex as well in cell-mediated immunity, doesn't really work as well. And if anything, your body attacks that. And so therefore you get an extreme amount of pain because your body's supposed to not attack itself. Okay. So here, whenever you have a delayed type hypersensitivity, these are going to be considered cell-mediated immune reactions or part of cell-mediated immunity. And the idea here is that you have a variety of cell types. The antibodies don't play a role at all. And the idea here is that we're going to talk about the exact steps that go into this. But an example of this is the TB test that you have to take. At least I have to take every year. Okay. If you have some autoimmune diseases. So the idea here with autoimmune diseases is that the body recognizes certain body tissues as non-self instead of self. And so therefore it starts to attack your own immune system or your own system. Okay. So if you have like lupus or Graves' disease or something like that, there's a lot of different ones. There's so many more. They can be organ specific, non-organ specific. But the idea here is that the idea here is that they're no longer able to realize that that's their body. That's the right self. That's the self. They recognize it as non-self. And so therefore the immune system starts to attack that. A lot of times too, people will tell you this causes a lot of pain. Autoimmune system diseases are not fun. It also helps that their immune system essentially overactivating themselves. They can't fight off infections that they can get from other pathogens as easily. Okay, if they're immunosuppressed, essentially what that means is that they're gonna be their immune system's not going to work as effectively, and that can become another number of different reasons. You can talk about any type of when we talk about acquired immunodeficiencies. What those are is if you are undergoing cancer treatment, if you're taking any type of chemotherapy drug. Your body, chemotherapy works by killing your fast-growing cells. Your fast-growing cells are essentially what makes up your immune system. So therefore, if you are taking these cancer chemotherapy drugs, you're more susceptible and you're immunosuppressed because your immune system is not going to function properly because as soon as you make those fast cells, the chemotherapy is going to kill it. Okay, irradiation does the same thing. And then if you have HIV, obviously, remember I told you HIV, they specifically target the T cells, specifically your cytotoxic T cells. So therefore, cell-mediated immunity is kind of out of the picture for you. Okay? If you have some inherited immunodeficiencies, ideally here, this would be wherever you have your antibody function's not going to be, antibody production is not going to be as good as somebody else. If you have a phagocytic function, natural killing cell function, and complement activity. All of those don't work as well as they should. That would be a situation where you're inheriting that, because that's not something that really necessarily just stops working on its own. Obviously, if you're exposed to a great amount of radiation or a lot more chemotherapy drugs, I can't guarantee that that wouldn't happen because of specific, deformity or specific, way that it would basically change. Okay. Um, a lot of times too, people will be not able to produce antibodies, and so therefore they have to be giving antibodies. These people are also suppressed as well. Okay. We're not going to be really concerned about immunodiagnostic procedures, but ideally, what happens here is you take some person of somebody's blood and you're looking for a specific infection or whether or not they have antibodies. Okay. And if their vaccination worked. Okay. 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 So this agglutination process, this involves a situation where we're going to talk about when we're looking at blood typing specifically. But what happens is that with your blood type, it's all based off of antibodies and antigens. Okay. So type A is going to have type A antibodies and type B antigen. No, type A antibodies, or type A antigens and type B antibodies. Okay. And therefore, the type B antibodies are going to recognize if you put with a type if you put it with the correct typing here. Okay. Essentially, what happens here is the anti-A serum is going to have the A antibodies, and therefore an A antibody is going to recognize an A antigen, and therefore it's going to start blood clotting, agglutination. Okay. If you have a B anti-B serum, you're going to have a B antibody, nothing happens. With type B, we have A, there's no A antigen, so who cares? Here we have a B antigen because they have type B has B antigens, A antibodies. Okay, you have to have one of B and one of A for it to be type A or B. Okay, so type A has type A antigens, type B antibodies. Type B has B antigens and A antibodies. Type AB has both antigens, and type O has both antibodies. Okay. That's why this is the universal acceptor and a universal donor. Okay. Okay. So again, whenever you're looking also too for blood typing, you're also going to be looking at the Rh antigen. So if it's positive, it means that you have the antigen. If it's negative, it means you have the antibodies. Okay. 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 So a lot of times here, this is skin testing. This is going to be the TB skin test. Other ways, we're going to basically, a lot of times too, this involves getting blood and essentially looking at your B cell counts, whether or not, spiking your blood with specific things and seeing what happens, looking at complement deficiencies. All of this happens within your blood, and therefore you need to be able, so the only thing that really works is a good blood sample a lot of times for that. Okay, and that's it for this video. I will go ahead and post a video from my projector online as well to accompany this entire lecture. Okay. Okay.